Working together, the NHS in South Yorkshire, including hospitals, doctors, surgeries, pharmacists, dentists, community and mental health, and ambulance trusts, have developed a plan for how the NHS will play its part in improving the health and well-being of people in South Yorkshire in the next few years. This is called our Joint Forward Plan. To help write our plan, we asked people in South Yorkshire what matters to you about your health and well-being, and more than 2,500 people responded to tell us. We want to be able to get appointments and treatment when and where we need it. When you plan our care, think about how costs for transport, parking and medication might affect us. We need it to be cheaper to live a healthy lifestyle. We want to be in control of our own care and have the information and tools to be able to do this. We also looked at what health data tells us about South Yorkshire, such as people typically live shorter lives in South Yorkshire and are unwell for longer than the rest of the country. People who live in poorer areas of South Yorkshire typically die more than 7 years earlier and live in poor health for a much longer amount of time than the people who live in wealthier areas. The biggest causes of death in South Yorkshire are heart disease, COVID-19, lung cancer, respiratory disease, stroke and dementia. We need to pay particular attention to some of our communities, such as those who live in the poorer areas or are from ethnic minority populations, as these are most at risk of experiencing poorer health. We also have a number of key challenges. Reducing the amount of time people have to wait for an ambulance. Reducing the amount of time people have to wait for a hospital procedure. Improving mental health support for children, young people and adults. Dealing with the increasing pressure on primary care, such as GPs and dentists. We have taken all this information and chosen to focus on areas where we need to make a big difference. Our plan includes more information about how we will do this for each of our areas of focus, which are focusing on those with the greatest health needs, improving services for maternity, children and young people, improving access to primary care such as GPs, dentists and pharmacies, making health services in the community better, developing alternatives to A&E for urgent but not life-threatening care, working to get people seen in the right parts of the hospital at the right time and get people out of hospital quickly and to the right care outside of hospital, reducing the wait times for diagnosis and treatment of cancer and other conditions, improving mental health services for children, young people and adults, improving services for those with learning disabilities and autism, working more closely with our citizens and with voluntary and community organisations who can help people to live well and stay well for longer, supporting, keeping and growing our workforce to meet modern healthcare needs, using modern innovations, research and technology to improve services. We know that this is a lot for us to work towards, and we will take a step-by-step approach which will focus first on reducing waiting times as well as working with our partners outside the NHS, for example, working with councils and voluntary and community organisations to make it easier for all of us to take steps to help prevent long-term ill health. We also know we need to include all of these things to give our citizens and patients the health services they deserve. For more information on our Joint Forward Plan, visit the NHS South Yorkshire website at southyorkshire.icb.nhs.uk.